Now, when and if you decide to start a family is a very personal thing. So here with information on women's reproductive health and ways we can increase your chances of getting pregnant if you want to do that. Please welcome Dr. Marjorie Dixon. You know, we talk about this because it comes up again and again and again. And I know so many people that are struggling with fertility, and it's the sort of conversation that you need to start having so young, younger than you might think.
Absolutely, positively.
Right, so let's talk about egg health in general, what we're looking at in terms of age and how to make sure you have the optimal eggs.
Okay, cool. So I often, even to medical students when I'm teaching, I say ovaries are different than testicles, which is the obvious statement.
Yes.
But ovaries are egg storage units. So we are born with a certain number of eggs and we deplete them over our lifetimes. Actually, the maximum number of eggs we ever have in our ovaries is when we're in utero, in our mother's bellies at 4 months of gestation. So by the time you've hit the earth, you've already depleted your ovarian baskets down to 1 million eggs. By the time you get your first period,
down to 1 million eggs?
By the time, you're born.
Okay.
Then by the time you get your first period, you're down to about 400,000.
Okay.
You should ovulate about 400 times in your life.
Yeah.
And by the time you get to menopause, which is like 50, when you have about 1,000 eggs left, but they're not very good.
Okay.
But the same eggs that were on the shelf in your mother's belly are the eggs that you're ovulating now.
Oh, so you make that first batch and you don't make any more batches?
Es todo finito banana, yes.
Okay.
And so that's why it's so important for people to understand that by the time you're 35, you're considered advanced maternal age.
Yes.
So that means that the quality of the eggs is really at a point where it's hard to fertilize, it's harder to get pregnant, your risk of miscarriage is greater, which is why it's so important to talk about what can you do to preserve your fertility or to understand what your fertility is so that you can give yourself options young.
Okay.
So that means in your 20s, when your eggs are ideal. We're made to have babies 15 to 21.
Between 15 and 21.
Yeah, I know.
That's not convenient with
so
life.
I know, and there's been a huge...
Like, I just want to be in grade 11. I don't want to have a baby.
Well, and that's fine.
But that's when you have the optimal, the optimal time for you to be...
I am not recommending, I should say this out loud, I'm not recommending the 15 to 21-year-olds go out and have babies because people are going to be like, oh, you're so nice. But there are things that 20 to 30-year-olds can do. One is educate themselves about the lifespan of their eggs because that's when they're ideal. And that's if you're just trying to get pregnant in your 20s, it's probably the easiest for you to get pregnant.
Yes.
But if you are getting a career,
yes,
if you are getting educated, if you're not partnering with the first schmuck that you meet,
yes,
if you actually want to like the person you partner with, if you want to travel and emigrate to a different country and look at opportunities for your career, be socioeconomically stable, buy a house, you have options. And people need to understand that the best time to explore those options are in your 20s and early 30s.
What kind of options do you have then?
The option is to freeze your eggs.
Freeze them.
So you can cryopreserve eggs. So up until 2013, we didn't have a good way of cryopreserving the eggs, so we didn't know how to make them last long in a freezer. And then when we would warm them and fertilize them, we weren't very good at making babies from them. So now we have something called vitrification, which allows us to rapidly flash freeze eggs, and we can keep those eggs a long time.
Okay.
And the quality of the eggs is only as good of the quality as when you freeze them. So if you freeze them when you're 21 to 26, those are generally good quality eggs.
Okay.
When you freeze them past 35, they're not very good quality. So people need to look at that. If you don't want to have a baby, that's fine.
Yeah.
But if you do, and having a family is important, these are options that are available and accessible to women in North America globally. And this is an option for you.
Can we talk about money then? Because the problem is when you're a 21-year-old, you're thinking maybe about tuition, the amount of money it will cost to freeze these eggs, and how that process works. So how much does it usually cost?
So it's usually somewhere between $5,000 to $8,000.
Per frozen batch or per frozen egg?
And that's an excellent question. So it's per frozen batch. And it's important to know that not every woman's created equal. So we can stimulate someone, take eggs out, and only get 8 eggs in that batch. Or in another woman, we might get 20 eggs in a batch. And ideally, to have enough eggs to feel comfortable that when you come back when you're ready, if you ever are ready and don't just have sex and get pregnant, we want you to have somewhere between 18 to 30 eggs frozen. So some women may need to freeze multiple times to get enough of a batch and to go on with peace of mind, I have an insurance plan. But another woman might just need to have 1 cycle of egg freezing. And for some women, it might not even be an option because sometimes, even early on, we find out that the quality of someone's eggs is less than we would anticipate.
Would you know that right away?
You would have an idea of it. So women should have an egg health check in their 20s to 30s. I know.
Who knew that
well,
existed?
That's why we're talking.
Okay.
So you can go to your family doctor, you can go to a primary care provider, and you say, I just want to have an egg check. I want to know about my egg health. It's a blood test. You can do an anti-Mullerian hormone known as an AMH, a day 3 FSH, and an ultrasound that's called an antral follicle count. So it just looks at you baseline.
Yeah.
It's just looking at where you are as a capture in time. It doesn't tell you where you'll be in 5 years. It doesn't tell you where you're in 10 years. It tells you where you are then.
Yeah.
If you're a candidate for freezing, if you're interested in it, or if you have stupendous ovarian reserve and you're like, I just want to know where I was at, and I'm not quite ready to freeze. I'll freeze my eggs when I'm 28 if I still look okay, right?
Okay.
Like it allows people to make a plan. We plan everything in life. And I think that it's important for women to have the conversation, to empower themselves to plan their family building. If you don't want to have a baby again, that's fine. You don't want to have a family, you'll adopt, whatever you want to do. But what I despise is when I see, you know, well-spoken professional women in their late 30s, early 40s who are saying, I wish someone had said this to me earlier.
Yeah, I didn't know.
So now we're having the conversation.
When you freeze the eggs, do they stay at that same level of health from a moment they're frozen to the moment you want to use them for
yes.
in vitro?
And that's why it's so important to freeze sooner rather than later.
So they're going to stay at that health,
Yes.
that 21-year-old health or that 22-year-old health?
Yes.
Oh,
Generally
okay.
speaking. And
Generally
also,
speaking.
it's important for people to know that where you freeze your eggs matters. So the quality of your lab, the
Okay.
technicians who are involved, you have to ask the questions of the place you're being referred to. Do you do this on a regular basis? When you warm an egg, how likely are you to be able to fertilize it? Like those are very, not every egg freezing program is created equal. So
Yeah.
it's important to ask those questions as well.
And do you have to pay to store those eggs?
Yes, you do. So there's an annual fee. It's liquid nitrogen that keeps them frozen.
Yeah.
But it's nominal. It's like in the $300s, $400.
Like a month or?
A year.
Okay.
A month. No, not a month. That would be lots.
That'd be a lot.
That'd be a lot.
Is it like the storage containers where you put your furniture when you downsize?
No, we
It's
call
a little
them doers.
different?
It's a little bit
a little
different.
different?
We're going to talk science and tech. But yeah, it's a little bit different. They're liquid nitrogen. They're in straws. They're all identified. We have like barcoding, lettering, colored. Like we'll know it's. I know it's fancy.
Listen, if I was a millionaire, I'd have 8 of them, 8 babies.
8, but you don't need $1 million
All
for
the
8 babies.
babies.
8 babies are cheap.
And I wish I would have known this information because
that's
there are
the
a lot
thing.
of young people that, you know, or people that are my age now that didn't know
Yeah.
that and then we didn't take precautions
We
and what
need
have
to
you.
do a better job because
Yeah.
we're not letting young women know what their options are. So that's
Totally.
why it's great we're having a conversation today.
Good, Dr. Marjorie. Thank you so much.